It's rewarding and scary to hear you say that, because we were even actually earlier today. Long story short, we are involved in a grant process right now with a few healthcare providers to try and pursue a certain area of research, and we're talking about impact. What is the impact of ultimately patient engagement, retention, etc. And we keep we keep coming back to the fact it's like, yes, we can look at this through the lens of revenue and commerciality, and there is a truth in that. And
Mhm.
people don't complete their clinical journey. Full stop. A lot of people don't,
Yep.
and that creates an enormous inefficiency and burden on healthcare provider systems. And we're looking at this in the context of the NHS in the UK, which is a huge healthcare provider. If you get someone 50% of the way through a clinical journey and they drop off and they have to come back in 6 months' time or 12 months' time and restart, you have just consumed inefficiently 50% of a clinical pathway. And it is not good for the patient, and it is really not good for the provider, because now they're doing 1.5 times the care to deliver one outcome. And this is bad. I mean, you talk about napkin math that doesn't work. That is napkin math that does not work. And I think it's absolutely the case that it's too easy to say, oh yeah, reactivation is important because it's a revenue issue. It is a revenue issue. It is also a care-based issue. You need to keep people through the journey. These are ultimately outpatient care, and like if you go home, and just like you want someone to do their exercises or take their medication or whatever it might be, they need to continue with the journey. They need help getting there. And we always say, you don't understand who you're competing with when they walk out of the clinic. You're competing with Netflix. You're competing with Meta and with YouTube. This is your competition. It's not the clinic down the road. Your competition is companies that are operating, over billions and billions and billions of people with unlimited resources to grab attention. You have to be able to compete with them.
Yeah.
That is a very uphill battle for a healthcare provider. It's a really hard thing to do.